Hello, hello. Welcome back to another Monday. This is Dentistry Gone Wild, and I am your co-host, Melissa Turner, and I am here with my lovely co-host, Sonya Dunbar, and we are excited to be with you today, Sonya.
Hey, I'm so excited to be here with you, Melissa. How are you doing before we jump in and get started?
I'm doing okay. I'm ready. I'm watching Scandal right now on Netflix. No, on Hulu. I'm watching Scandal on Hulu, and I'm kind of thinking about that because my workday is ending right now. So I'm ready to go binge on some Hulu right now. How about you,
That is
Sonia?
such an old show,
I
you know.
know.
But Carrie watching what is her name in
Yes,
Scandal? What is
Olivia
her
Pope. Olivia
Olivia?
Pope.
Baby, those outfits are everything that she has, and her hair is always together. She is my shiro.
Yes, and she has
About
some.
her clothes, her
Yeah,
clothes.
yeah, yeah,
And that
and
president is sexy.
oh, I know, and the chemistry between them. Okay, there we
Ah,
go.
I know, but it gets kind of crazy toward the end, though. Just to let you know, it's
Yeah,
just
it
all
does.
off on some different type of stuff.
Okay, I'm
But
like season 2 right now, so whatever.
yeah, I had when I had surgery a few years ago, I had to stay home and I watched them all in like 2 week period. It was so amazing.
Aren't there like 7 seasons?
I loved it 2 weeks. But we have an amazing guest here. This doctor, she's a dentist. I met her at the special care dentistry conference several years ago, and she was so friendly and so full of joy. Matter of fact, her name is Dr. Joy. I'll let her say
Hey.
her own last name, but I want to bring her on in. She's just a nice person, a pleasure to have on our team. Hey, Doc.
Hey, I watched Scandal too, and you're absolutely right, Sonia. That last season, oh my gosh! I mean, it's just but I stayed the course. I finished it, and I'm glad that I did. It was good closure. It was good closure.
We needed that closure, but it was kind of like at the end, and
I
I was
know
like,
it was
that
all
was
over
so
the place. I'm like,
crazy.
what?
They
Okay,
What
messed it
happened
all
to
up.
my Scandal? But
all I
it is.
all I have to say, season 1, episode 6. That
It's
I think it's
everything.
episode 6. That's my favorite. Okay, and now we can move on.
Everybody go push rewind. Let me go back to my so
Exactly.
I'm on my third time watching The Office. So I'm pretty happy with that. I love The Office. But Dr. Joy, thank you for being here with us today.
Thanks for
So
having me.
you practice in Chicago. Could you
Yes.
tell us a little bit about your mobile practice?
You got it. So I started about 15 years ago. And as a bit of a background, I graduated right at the height of cosmetic dentistry, right? So we were learning all these wonderful, great materials like bioglass and all these incredible things that we could do with veneers. And I don't know if you guys remember or not, but the People magazine, the Chandler issue with his six. Do you remember that, like the six, chiclets, top and bottom, and we all just went like, "What?" I mean, but that was like the height of dentistry for me. That's what I was learning. I was really interested in. Kind of spent a lot of my time in my general practice residency, exploring the different materials and working with veneers and such. And so, fast forward when I, got my practice, when I bought my own practice, a family, practice in a lovely neighborhood of Chicago. Um, it never dawned on me that geriatrics was going to become such a major part of my life, a part of my career. And it all started with my grandma.
Hmm.
She needed a new lower partial denture, and she had horrible sciatica going down her right leg. And God bless her, the woman was, what, 89 at the time. So I mean, they were in pain management at this point. They had tried different things. We were down to pain management. So I went to her house and brought a Dremel with, sterilized drill bits, and we were able to adjust it. And I remember inserting it on a Friday. And then on Sunday, she went to church, and I got a frantic call from my aunt because she's like, all right, she's telling everyone at her senior ladies guild that you make house calls. Okay. Thanks for the warning. Not a problem. Didn't think much of it until the following day. I am in, my office, and I'm, treating a 12-year-old, and I get a phone call. And sure enough, this woman, was like, can you help me? My grandmother, has a problem. And what boggled my mind, and I've shared this story several times, but I think it really, just puts weight on what we do and why we do it, is that she had they were brushing her teeth, but she was completely edentulous. She had complete upper, complete lower dentures. They were brushing her denture teeth. And this woman had had a stroke 2 years prior. These dentures had not been removed. She had been a very private woman. She's a widow. But what boggles my mind is that, okay, so she has a stroke. So she's in the hospital. So she's met with doctors. She's met with nurses. She's met with CNAs. No one bothered to look to see if she had any prosthesis in her mouth, right? Maybe they would have if she needed surgery, right? Maybe they would have. Maybe the surgical team would have, done a little bit more due diligence on that. But she didn't need surgery, so that was not done. Now she's at home. And she's got a home health, agency working with her. None of them even, to look up and to pull the lower lip down. It just never. We don't know. We don't know what we don't know, right? And it was not like there was any neglect involved. This family. I mean, I had the entire family surrounding me with this poor woman in her bed. They were completely surrounding her bed, all like, leaning forward, all anxious to see what the problem was. And the problem was that she had these dentures. And so you can imagine what, were on these dentures when I took them out. And at first they didn't believe me. I said, she's got dentures. These are dentures. And they were like, no, that's impossible. No one knew. Like, they're all like, nope, didn't know that. It can't be. Take the dentures out. The stink. It was bad. I mean, you can imagine. And so people were running out of the room because it was, it was bad. And fortunately we were able to clear it all up. She had obviously thrush and some other issues. We were able to clear them up. And it was a crash course in Dentures 101. And it was just an aha moment for me. I'm like, oh my gosh, this is something that I have to do. I have to share my knowledge with other people, with agencies and with caregivers and loved ones, because we don't know what we don't know. And that's how it all started. And it was completely grassroots. One person called another person, and then this one social worker, and then this other social worker. And now I go to over 15 different, they don't like being called nursing homes anymore. So, communities, senior care communities. And I also go into people's homes. And someone asked me the other day, what's the percentage? And right now it's about 50-50. I will drive, an hour one way to go take care of someone, because that's how strongly I feel about this. And if not me, then whom? So yeah, so that's what it really comes down to. And, part of it really comes down to education. So, it takes no time at all for us to take a look in the mouth and see what's going on, right? I mean, we can do a comprehensive exam, and we can take a look and we know what's up. I spend more time educating the loved ones and the caregivers on, okay, what I'm seeing, the condition, how the condition got that way, why the condition got that way, what we can do about it, the materials to be using, and the daily oral care. Because you probably already know too that in the ADLs, the activities of daily living, dentistry is not mentioned at all. Brushing and flossing, it's not mentioned. They talk about showers, and they talk about, dressing, right? They talk about feeding. They don't talk about brushing the teeth or remembering to put the dentures in if they have the dentures. And also what I find very interesting too is that there also, when someone is being admitted either into a home health agency or into a nursing home, there's like maybe 9 questions when it concerns the mouth. And of those 9 questions, okay, do they have dentures? Great. There's no questions like, can they take the dentures in and out by themselves? What kind of dentures are they? Are they okay? I mean, is there a broken tooth? Is there a broken clasp? None of this. And so a lot of times too, people will be going into a home or will be entering into home health with a home health agency or with even with hospice. And there's no talk about, well, this person has lost a considerable amount of weight, right? And now the dentures don't fit. But there's fear on cost, right? So we don't know about, or they don't know that we can rely on a denture, or maybe the clasp just need to be tightened, or maybe a clasp can be added. Or, if someone lost a tooth, we can add that tooth to the denture, or we can add that tooth to the partial. And then don't even get me started about the swabs.
Don't talk. Those swabs that's just a death wish waiting to happen.
No, wait. Are we talking about when they swab the tooth instead of brushing?
Swab the mouth, yeah.
It's a 4-letter word, Scott. That's all I'm going to say. SWAB. Yeah,
It's not
and so,
good. And those are bad for aspirations.
oh, thank you. They bite on it and it pulls right off, and then
It
they can
gets
aspirate
lodged.
it.
Yep. That I had one nursing home administrator who would not allow them in the door because of someone died from that. They
Oh,
aspirated it and they died.
oh
It was
yeah.
just horrible. And talking about that, just last week when we were in a nursing home, a lady, very pretty, white, curly hair, nice glasses, red lipstick, about maybe 89 years old, always wore a blazer, even in the summertime in Georgia. Um, she rolls in there smelling like a back of a church bus with all this perfume on. And she smiles and the dentist and I are looking, and because she has a lot of teeth. I'm like, she has a lot of nice teeth. I said, Doc, that's a clamp. So he said, well, take the partial out. Ladies and gentlemen, I took that partial out and both of her canines came out. Just broke off at the gum line. And I'm like, y'all can't see my face. My eyeballs are big as golf balls. I'm just like, and the doctor was like, I'm like, oh man, I messed up. I've done an extraction. I'm in so much trouble. This is none of my scope of. First of all, there was no roots connected. They just broke up at the gum line.
Yeah.
And he said, Sonya, it was going to happen anyway.
Yeah.
And
Just
you know
cement
what
them,
she
cement them
said?
back on, right?
She said,
Sure.
she said, I didn't even have a partial in.
Yeah. Yeah.
Huh.
Yeah. But the good thing is we were able to put it back in with the back clamps. So
Woo!
we took the teeth out. She's missing two canines right there. But we're gonna next time we're gonna take another impression. He's gonna remove the root tips, let the swelling go down. We're
Yeah.
gonna take another impression to make it. But I showed the administrator, and this is how I work. I showed the administrator a picture of it. I said, now can I do an in-service for your staff? Can I please teach your CNAs how to brush people's teeth? Some kind of way. I'll even bring them pizza. I want to do 3 for morning, afternoon, and evening. I'll stay all day and do 3 in services because they need it. But it doesn't make sense because they'll quit and then it's a whole nother crew the next month when you go. But I just wanted to piggyback on that. That's the oral care in some of these nursing homes are horrible. So, Doc, we thank you for what you do. So now, tell us if they're dentists listening, how can they get started doing this?
Absolutely. Call me.
Okay, so what's your phone number? Here we
Well, thank you for
go.
the referral, Doc, the other day. You sent me the Parkinson. Was that what
Yeah,
you sent me?
yeah.
A lady, her
It's
mother had Parkinson's or MS, and you sent her to me in Florida. Here, thank you for that.
You're very, very welcome. You're the first person I thought of course. And that's what this is all about, right? We have to be able to help each other out. We are resources for each other, right?
Yes,
I'm
yes.
in Chicago, Elisa, Dr. Kaufman's in, New York. We've got Sonia, we've got you, down,
Florida,
in
Georgia.
Georgia and
That's a
Florida.
rock.
Thank goodness, that's really incredible. We have to be able to provide these kind of resources, for, the agencies that, I was doing a panel. So Sonia, I was doing a panel for HCCI, which is a home care institute and home care centered institute, I believe it's called.
Mm.
And they found me on LinkedIn and they asked me to be part of a panel. Fantastic. And the it was a Zoom, so the chats, I didn't know this existed. I can't believe that someone does this. She can't be the only one. Where do I mean, it was the scrolls of all these people that were home healthcare managers that have been in the business for a long time. These are people that, because we all did a little like, minute, bio of each other. These are well seasoned healthcare managers, and they were unaware that their mobile dentistry does exist. And so once again, we just have to be out there and tooting our horns and saying yes, and we're important. In fact, someone asked me the as part of the panel, when do I want to see the patient? I'm like, immediately. It is the physician or nurse practitioner or physician's assistant, whoever is going to be going in there to do the first assessment, and I'm following up right immediately after that, because I want to make sure that if this person is losing weight, yes, the blood tests are important, and yes, we need to push fluids, absolutely, but we also need to see what's going on in the mouth. And then that's
Absolutely.
crucial. It's crucial. So yeah. So I mean, just as okay, what happened today? I almost was late for our conversation because I get a phone call from a frantic daughter-in-law. I had just inserted brand new flexi dentures, upper and lower partial dentures in a home, and it's she's an assisted. I was trying to think what she's in. She's in assisted nursing, so she's not skilled. She's assisted, and her gums are all puffy, and the daughter-in-law had asked for you know well, let's take a look at the dentures. Louise, the caregiver, can you take them out? What do you mean take them out? I had inserted these partials 2 weeks ago. I had spent time showing the caregiver how to take them in and take them out, and then I had her do it. And I thought we were in good shape. Well, she's only there 1 day a week.
Oh my gosh.
So she did not, number one, not only did she not take the teeth out like I asked her to 3 hours later when she had her dinner, but they have never come out. And now this poor woman is not eating. And she's calling me frantic. And fortunately, the nurse who I adore, I worked with him several times. He was able to take the dentures out, and she'll heal, and I'll be back in a week probably to do a follow up. But it's situations like that. I mean, writing a book. I mean, Sonya, I know that you have. I'm right there with you because I mean these stories are true. And once again, it's not that people don't care. People do care. I think the caregiver, that night, she probably got afraid. And just like you were saying, Sonya, about the teeth coming out, that when I do my in-service meetings, I talk about that. What happens when, something comes out when someone is eating their dinner? What's their first inclination? They're going to want to try to put it right back up in again because they're afraid, right, that they're going to get in trouble. And I can't stress it enough. I'm like, well, I hand out dentures and bridges. I obviously, the bridges are sterile. They're in a, sterilized bag. I pass them around so they can see the difference. So they understand at least that basic, dental terminology, because they interchange those terms so often. I got a frantic call from a nurse. This is a couple years ago now. Doc, the denture came out. We don't know what to do. It's not going back in. We're having a problem. I had never seen this resident before. And I'm like, can you take a picture of it? Before teledentistry got to be what it is. I'm like, I've been asking for pictures for 5 years. And she did. She sent me the picture. It was a gold crown. It was not a denture. It was a gold crown. And it was Halloween. And candy had been distributed, and I'm sure we've been there, where something like that has happened. There's been some kind of festivity, and they're going to have a snack, and wasn't dental approved.
You think?
So, Dr. Joy, okay.
Yeah.
So, my grandmother right now, I mean, I am one of the queens of mobile dentistry along with you guys, right? And my grandmother right now is about to enter hospice in Pennsylvania, the whole way across the country. And her entire complaint since she's been in an assisted living facility is her mouth. Her mouth burns, her mouth dries. It's hard to eat. It just hurts. It hurts. But she's got dementia. She's got a hard time, right, explaining this, and the caregivers aren't doing much. So for years now, it has been breaking my heart.
Yeah.
Because I know that she has been struggling with this, and I try to relay the information. I try to speak with the dentist, and it just nothing works. So in your opinion, what do you think it would take for the caregivers and for the dental providers to get with the times, to begin to, instead of just following up on all these cases that you've been talking about, all these things that are falling out, whether it's a denture or a crown, what is it going to take to get everyone on the same page and to bring this part of the population to where they need to be with health?
I really think making it a federal regulation as part of the American, or as part of the ADLs, as part of the activities of daily living. I think it starts at the top. It starts at the top. And you put in brushing, you put in that brushing twice a day. I can't tell you how many, since I've started doing this, how many physician's orders I have written. Please brush residents' teeth twice a day. Please brush residents' teeth twice a day. I have to write physician's orders, because if it's not being done, it's not being done. So therefore, if I write it now the floor nurse or the charge nurse has to sign off on it. The director of nursing has to sign off on it, and I put continuous. So it's now a legal document. Now it's law, right? Now it's legal doc. Now we got legal involved. And so now they have to carry that physician's orders to the next month. and to the next month and to the next month. And then sometimes, unfortunately, things get thrown out at the end of the year for the following year. So now I'm going through them
Mm.
and making sure that I have to start all over again with these physician's orders, because I don't want to give up and assume that they are being, those same teeth are being brushed if they're still with us, if these residents are still with us. So that is the number one. It starts at the top. I have a fantastic director of nursing in one of the homes that I go to, and it is an independent. It's one of the stages. It's independent living. It's assisted, skilled, and then memory care. And she had me in for an in-service, and I'm showing things around. And I always started with a question and answer. Do you guys have any questions, any concerns, any things that you have seen that you'd like us to discuss today? And it's nothing. It's, you can hear a pin drop, right? I start showing them things, and all of a sudden hands are beginning raised. It's like, oh, oh yeah, and then what about this? And what do you think about Sarah? And it is they all came together, and it was a wonderful, wonderful conversation. And I see that happening time and time again, because they'll start bringing up individual cases, and we can start talking about individual care. For a situation like that, I want pictures. I want pictures of her tongue. I want to see what her tongue looks like. Burning tongue syndrome, is she anemic?
Diabetic.
Yes, okay, is she going into hospice? Fantastic. I still want to know what her iron levels are, and how is her diet? Is she getting a diet that's reflective of the fact that she potentially may be anemic? I find a lot of problems with hospice too, and I sound like a Daisy Downer today. I'm so sorry, ladies, but it's with hospice too. The first thing that they get are those swabs that we talked about, and they just stop everything, and that includes brushing or taking care of the mouth, and it's really scary to me. So it's making sure that they're part of activities of daily living, and I want to make the staff accountable. So I want pictures. I want to know how you're saying that she's got dry mouth. Well, okay, what are we using for dry mouth? What does she have in her room, or what does she have in her suite that is being used for that? Is it being used regularly? Is this being, she's having problems swallowing too. Is she using her dry mouth product, 5 to 20 minutes before she's going to eat something, so that can help lubricate her mouth and the back of her throat so she can swallow better? What products are being, what's being done for her? And then, getting in contact with, with the people, the powers that be that are providing oral care, and ultimately, getting that physician's order to make sure that she is being properly cared for. And it's unfortunate, because then it really becomes a case by case basis.
Mhm.
But like I said, they have to follow that.
They
And
have to.
and it's, yeah, I mean, it can become a problem if they don't. And I'm there a lot. And what's also come down to too is that I don't always announce when I'm coming, because when it's announced that I'm coming, boy, their mouths are beautiful. They're so clean. But if I don't announce that I'm
But
coming, if I don't announce that I'm coming, then I can see the real picture. I can see the true story,
well, at
and
least
then
they
we have to have a
respect you.
conversation. Huh?
At least they respect you to brush their teeth before you come, because you probably, I tell people all the time, I'm running to family members, and they say, am I making too much noise? Am I being fussy? I say, no, the squeaky wheel gets the oil. At least when
Yes.
they know every month when we're coming, and
Oh,
they don't even care to even try to brush their teeth. But docs, just in case, I'm gonna clear up some things, just in case
yes,
there's
please.
people listening who don't know.
Yes.
Um, you says SNF. A SNF is a long-term care facility or a
Yes.
nursing home, and a assisted living facility. After you say the acronyms ATAFL or
Sure.
ALF, assisted living facility. I wanted to tell people what those are. ALF is assisted living, where and then you said skilled nursing. Skilled
Yeah.
nursing is where someone has to have 24-hour care, and assisted living is where they can kind of live on their own, and they have their own kind of apartment where someone would come in and give them maybe their medicine, but they can still bathe. And what happens is, when they the ADL activities of daily living, that's what that is. And it's usually when you can't do two of them, that's when you go into long-term care. So it's like bathing, eating, walking. What's the other one? Baby, eating, walking, doc. What are the other two? Do you remember? Um,
Oh, well,
You have,
being able to dress themselves and being able to get
yeah,
out of bed. They have to be able to get
yes.
out of bed on their own.
So those are the five. If you can't do two of those five, and you live in an assisted living facility, you go to a long term. They sometimes kind of push you to a long term care facility. Now, if you break a hip or something and you can't do it for several months, that doesn't mean that you have to go into long term care facility. But if you can't do the five daily living activities, then you probably qualify for long term care. Now, you said something that resonated with Melissa and I. We need to get dental added to brushing added to assisted when the ADLs.
Hmm.
So you think if someone can't brush their own teeth, that they need to, or are you saying it needs to be added to something that the team does every day in a nursing home? See, those are two different things there.
And that's very well said. Well said, and thank you for clarifying. And both. I think I think
All of the above.
all the above, all the above. If I think it should be part of the ADLs as one of the five things that if they can't do for themselves. So, for example, I will bring someone into their bathroom so they can brush their teeth because I want to see how they brush, even if their mouths are clean. Usually, after I clean their teeth, I want to go into the bathroom and see how they do it. I want to make sure they can find their toothbrush and their toothpaste. I want to make sure they can actually, use the toothpaste. I actually asked for physician's orders once for occupational therapy because the patient could not unscrew the tube of the toothpaste. So how can he brush his own teeth if he can't get the toothpaste on the toothbrush? Simple things like
Makes
that.
sense.
Or I say, let's get the flip top. I'll tell the caregivers, can we get the flip top toothpaste so they can at least flip it open and then should be able to squeeze the toothpaste on the toothbrush. Are they bringing the toothbrush to their mouths? Are they actually, once it's in the mouth, are they actually brushing their teeth? Are they brushing their teeth for, a certain period of time? Are they getting all their teeth? But I mean that has to be really detailed. But so to answer your question, so should it be part of ADLs? Is for brushing? Yes, is one of the five things that they can do on their own accord. Yes. Number two, should it be part of the activities of daily living that if they can't do it, that it's required by the CNAs, the certified nursing assistants, or caregivers if they've chosen to stay in place, to do it for them? Yes. That
Thank you.
should be it should be without even a shadow of a doubt. And it's unfortunate because other things will become priority. Can we get this person out of bed? How long does it take this person to get out of bed? How long does it take to put clothes on them? How long does it take to feed someone? Yes, all of those things incredibly important because we want to, every human being is incredibly important and they deserve all of that care. We The brushing is equally important. Equally
Thank you.
important. Yeah, because if we can't eat, we're not going to thrive, right? If we can't eat, we're not
Exactly.
going to
It's
thrive.
quality of
And
life, doc. It's quality of life,
it's
period.
quality of life.
Quality of life.
Absolutely.
Every unto death, we
Yes.
deserve a quality of life. I remember it was a lady in hospice. She always had lipstick on. She was
Yes.
2 days out of dying. Her family requested that I clean her teeth. I
Yes.
just went in and deplacked her. People thought I was crazy. Why are you doing that? But that's her quality until she takes her last breath. It's
Yes.
dignity and respect. And you and I are some crazy people because this we're getting off on this. We're so happy because it just makes us feel good knowing and listen, anyone listening, if this resonates with you and you're pediatric dentistry or you're grown and sexy dentistry, then you need to flip over to the queens of geriatric dentistry. If this is making you, I mean, it hurts our hearts, but it makes us happy to talk about it. Just like this is like we're just having a good time here, Melissa and Doc.
And this is
So
another thing too. How many patients do we have potentially that work in a nursing home or is an allied healthcare provider or works for a home health agency? This is a conversation we can have with our patients saying, hey, I know that you work for XYZ home health. How often are the teeth being brushed? Is this a thing? Is it important to your organization? Is it important to your particular, agency, your neighborhood agency? It's a conversation that we can have with our patients on a daily basis for those of us that have brick and mortars. We don't necessarily have to go out into the field right? That's not for everybody, and I totally respect that. But it's a conversation we can have. I mean, we know that the biggest population growing right now are our seniors. That's number one. But we also have
The baby boomers, baby.
baby boomers, but we also have that sandwich generation, right?
What's the
We've got
sandwich? Who's sandwiches? Who's
the
the
sandwich
sandwich?
generation is the people that have children but are also taking care of their parents.
Ooh, that's kind of
Ah.
like the
Sandwich
X and the
generation.
millenniums. That's the X's and the millenniums are kind of
My
those late
age.
millenniums
Yeah,
and
I'm
those X's.
48. So I'm
Yep.
48. My parents are 78 and 80. Okay. And I chose not to have children, so I don't have kids. But can you imagine? I mean, so I could be taking care of my children who potentially would be school aged, right? And now I'm taking care of my mom who's beginning to suffer from dementia.
I'm
And is
sorry,
in complete
Doc.
denial, and my dad is in complete denial over this too. And
I'm so
and
sorry.
so fortunately, I've got 3 other siblings, but I'm medical POA, so this is a power of attorney. So this is a conversation that I'm beginning to have
Mhm.
with my brother who's financial power of attorney, not always the same person. That's a whole nother story. I could tell you it's really kind of interesting. Not always the same
Siblings.
person. Oh boy. So yeah, lessons learned along the way. But yeah, these
That's gonna
are
be the book that you write is these these two things,
it'll be in the
POA.
book in chapter 3. Mind your POAs, mind your powers of attorney. But yeah, so it's it comes down to being able to have those conversations with the people right in front of us.
Mhm.
I'm a dentist, I'm a dental hygienist. I know that you work for this particular home, long-term care facility. you know how's the dentistry being done there? How's the oral health being done? And then maybe getting some free samples from a particular company or whatever, and being able to donate some product. I mean, a little bit goes a long way.
Mhm.
And if that's what we can, each one of us can do something to help educate and help our seniors improve their oral health. And it starts with us, because this is what we love to do. This is our
Absolutely.
passion. But I mean, on a daily basis, I'll be talking about what I'm doing, and oh, I know somebody. Oh yeah, I never thought of asking that question. Oh, thank you so much, doc. And do you have a dry mouth product that you think would work for my uncle? It's just starting that conversation,
Mhm.
and opening up their eyes on what might not be happening for their loved ones. And
Mhm.
that includes other dentists and other dental hygienists as well. They don't know what they don't know either. They may think that their grandmother's in a home and everything's hunky dory, but not necessarily if you yourself are in the healthcare field or in the oral healthcare field, and you assume it's being done, and we can't make those assumptions.
Well,
Wow.
Dr. Joy, words of wisdom. Thank you so much for being on here. If someone wants to reach out, what's the best way to contact you?
Yeah, so I'm actually going to give you my personal email address. Please feel free. I'm online all the time. So it's my initials. It's J as in Joy, V as in Victoria, P as in Poskozim. That's how you say my name, Dr. Joy Poskozim. But please, everyone calls me Dr. Joy. And the name was shortened once already, but that's for another time. But JVP Dent. jvpdent at gmail.com.
That's
Please feel free to email
awesome.
me if you have questions, concerns. I'd be more than happy to. If I can't help, then I can reach out to my peeps and ask, hey, we have a situation in.
That's
What
amazing.
can we do to help?
Yeah, thank you. And it's this kind of collaboration that will take us places. So speaking of Dr. Joy, if you want to get those brushing added to the ADLs, I mean, that's something that the American Mobile Teledentistry Alliance could help back you on. And
Yeah, let's do
so
it.
let's start that We'll start that conversation
We'll start
I
that
gotta come
offline.
reach
conversation
out to
offline.
you.
I'd love it. Let's do it.
Yeah.
Doc, can
Okay.
you when we get off, stay on when we get off.
No problems.
Awesome. Okay. Well, thanks everyone for listening. Sonia, you want to wrap?
Yes, thank you everyone for joining us on this amazing episode of Dentistry Going Wild. Please click, like, share, and subscribe to this YouTube channel. Tell somebody about this podcast. We're growing, and we're growing expeditiously. Thank you for joining us on this amazing Monday, and we're looking forward to seeing you again next Monday. Bye.
Love you all.